So what I'm going to show here right now is the flexibility of the nervous system by doing a straight leg raise and see how this works. So if I come up, that is starting to be where I feel a pull on this. And I'll try the other side. Okay. And so that's how much we have right there. Now the theory is when we apply oxygen to the skin, it goes directly into the nervous system and it makes changes. In this case, I want to put it up in the upper part of the neck because I think we can get a body-wide change by just putting it at the very top of the neck. So let's sit back up for a moment. I'm going to put just a little bit of gel in here. Don't need much more than that to do what I want to try. And I'm going to put it right up here in the suboccipital area. Again, I've got some hair there, so we'll see how well this does. But again, I'm just staying right in the upper part. Okay, let's have you lay on your back again. And we will see how that did. Okay, so we have a very significant difference with just a little bit of gel just up at the base of the neck. Again, and that works out on both sides. So that shows very quickly what happens when we apply the gel just at the neck area. Now what I'd like to also see is what happens when we put the gel on a muscle. So can I get you to roll on your side and face away from it? Now in a sideline position here, what I'm going to try and do is I want to keep her stable. I want a straight line. Can I bring that shoulder back just a little bit? There we go. I want to make sure that we're not doing any smoke and mirrors, so I've got her in a particular position. And now what I'm going to do is take the shoulder, stabilize the hip, bring the shoulder back. I want to see if how close this shoulder can get to the back of the table. So here we go. That is all I get.
I injured myself today.
You injured yourself today. Thank you very much. I appreciate that. Okay, so what we're going to do now is we're going to put the gel directly on a muscle that has a lot to do with that. Now, there's 5 different muscles that could be involved with this. I'm going to do just one of those muscles and see what we get. Can I get that arm over the top of the head for a moment? That's just going to allow me to come in and put the gel on. And I'll just use a little bit of the gel. And this is over the quadratus lumborum muscle. And this muscle typically is used to hip hike or to lean over to the side. So I've just put that much in. Now I'm going to wipe off the rest of the stuff because I always utilize whatever I can get for myself. And we'll bring this back and see if we had any change with the muscle with that amount. Okay, now we're beginning to get a little bit of movement. We didn't have much of any movement. I've got about a third of the movement that I'd like to see. So the next stage of this is I'm going to put the gel now on the nerve supply for the low back and see what happens when we put the gel at that location. Again, it's not a whole lot of gel, it's just a bit, but it generally tends to do the trick. So I'm putting this right up and down along the spine. And I'm going to get a little bit on the muscles just on either side of the spine. Okay, so that takes care of the nerve supply. We'll see if that did anything else, but we already have seen a significant change from doing just the neck and doing the muscle here. Let's see what happens with doing the nerve. Okay, that is just about perfect, and that's pretty impressive because we haven't done any specific body work, we haven't done any chiropractic. All we've done is applied oxygen. That's what we can see in the lower body. Let's see what we can do in the upper body. Go back up. Not too shabby?
No.
That's what your product does.
In the right hands. No pun intended.
Okay. Now, let's see what happens in the upper body. What I've done so far is just the neck portion up here, but just the upper neck. I didn't get the lower neck. The lower neck controls the arms. So what I'd like to do, bring this out, toss this down. This is going to show the flexibility of her bicep muscle. Really?
Yeah.
That is it. Okay, let's see what happens with her tricep. That's where we go. I would like that elbow to be way behind her ear right now. That's just not doing particularly well. Let's see what happens over here. Same thing. Okay, a big difference from side to side. And let's see the tricep. Tricep's stuck. She's trying to cheat by turning it out so she can go higher. We're not going to let her do that. So we're going to try a little, one other thing before I do that, because I'd like to see some of the other muscles down lower in the arm. So what I want to do here is turn her back out. That's actually very good motion. Come back here. That's not bad. Okay, she looks really good from the forearm down on this side. Then we come to the other side. Again, that's just perfect. That's exactly what we want to see. That is just fine. And that's a little restricted on the top. Okay. So again, not much below the elbows. So mostly what we're going to be seeing and looking for is what's going to be happening for the biceps and the triceps. So again, just a little bit more gel. And I'm doing the lower cervical area right now. There we go. Let's see if we had anything happen. Notice how quick I'm doing this. I'm not giving her a lot of time. Okay, we have made a fairly substantial change.
Yeah, feels a lot different.
And look at that. Again, not quite perfect, but still a whole lot better than where we started. And again, without any body work, without any chiropractic, she didn't do any major self-treatment. So these are the kind of results that people can get with the gel with a very little bit when they're instructed how to do it and where to place it.
Amen. Cut.
Right.